Hi, I'm back. I'm Dr. Chandra. I want to share my experience with Pfizer COVID-19 vaccine with you all. The first dose I took on 22nd of December, that is in my left deltoid muscle. On the first day, that day I took my vaccine, I got a little bit of soreness in that area, but most prominent was my headache, and there was a little bit swelling by the time I slept that evening. So I took Tylenol and slept. I was fine through the night. The next morning when I woke up, I had mild body aches and headache was back. So when the headache was severe, I was just waiting. I wanted to see how it goes. So by around 5 p.m. that second day after my first dose, I got chills and I felt feverish. There was a little bit of shaking. So I thought maybe I should take Tylenol at that time. So around 5 to 6 p.m. I took Tylenol, and after that everything was fine, no more issues. And after 19 days I took my second dose in my right deltoid. So the second dose you can take anywhere from 17 to 21 days. So when they schedule your vaccine, they will tell you and they will make sure you are in that period, in that window period. And you can choose which side you want the second time. I took left on the first and on the right deltoid muscle in the second dose. It just so happened. I didn't plan it. I just said, okay, do it here this time. You can do it in the same deltoid muscle the second time also. There is no indication or contraindication. So the first day after I took the second dose, there was a little bit swelling and soreness in that area. But I took Tylenol early in the morning itself. After I took my vaccine, I just took Tylenol because all the other doctors are doing the same thing. They said, just take Tylenol, you will be fine. And the good thing about second time is I did not have any headache. The first time, that was the most prominent problem I had. So that day I slept, it was all okay. So the second day after my second dose, when I woke up, I had severe body pains. And I felt feverish the whole day since the morning, but no headache. So after I had my breakfast that day, I took Tylenol. But still, the whole day I felt a little bit feverish, a little bit body aches, and I was asking my family members, "Do you feel cold?" They said, "No, it's good." But I was feeling cold. So I felt as though, I feel when you get cold, running nose, coughing, sneezing, like a flu symptoms with body aches. It's exactly like that, except that I don't have running nose, I don't have coughing, I don't have running or watery eyes. So except those features, the rest of the body pains and feeling feverish and feeling weak, everything resembled that the second day. So before I slept, I took another Tylenol. So I took 2 Tylenols on day 2 after second dose. And when I woke up in the morning, I was completely normal. Today is my 3rd day, so that's why I'm doing my video, so that I can give you what all I felt, my experience I can share with you until I get better. So I got better today, no more body aches, no more feeling feverish, no headache, no symptom, except a little bit sore in the deltoid muscle, a little bit pain when I touch it. Other than that, I am completely back to normal. So some of the in the Facebook groups of doctors, some doctors they said that they had some rare effects. I don't know how far they can be attributed to the vaccine. So here, remember, I only had experience with Pfizer vaccine, so I'm not going to speak about Moderna. I think symptoms, all the issues are similar with Moderna, except that it's given after 28 days, like 4 weeks. Plus or minus 4 days. So some of the rare effects that the other doctors were talking about were, some said that the skin tags on the neck, when we wear jewelry, we get skin tags in the neck. So those got inflamed and fell off. So they fell down. So it was a good thing, because they were saying, a few doctors explained that this happened after taking the vaccine. So probably it's a good thing those skin tags are falling off, but it's a few people said that. I don't know if it is a side effect or not, but that's what happened after taking the vaccine. And another person posted a picture of their family member who is like in 80s or 70s getting a skin rash after the dose of vaccine. So I don't know if this is a side effect of the one of the components of the vaccine, but that's also mentioned. But it's only one person that was that had it. So a few other people also said that they had lymph node swelling in the axilla. Like, if they got the vaccine in the left deltoid, the same side in the axilla or armpit, we call in common terms, those were swollen, and for some it lasted for a couple of weeks. So that's another rare effect that people were sharing that they had it. I mean, people in the sense of other doctors. So this is all my experience. I hope my experience will help give you an idea as to what you can expect. All the doctors are encouraging everybody to get it unless you have really bad reactions, like allergic reactions to some stuff in the past. Suppose you have like 20 allergies to 20 different things, then probably you should look at it more carefully. If you have any questions, you can always ask your family doctor. Please comment below if you have any questions to ask me about my experience. So I hope everybody gets the vaccine very soon, and I hope we come back to our regular life. Thank you very much. You have a good day. Please subscribe if you have not. The next few videos I want to talk about the health of Southeast Asians or Indians in America, like what we get and how to prevent heart attacks, how to prevent sudden death, how to prevent hospitalization, and what happens in the hospital when you go with chest pain, or how to reduce medical expenditure, medical bills when you go to the hospital, or how to talk to the doctor, how to reach the nurse, how to go around in the hospital to get the best care possible. So because I've been working in the hospital system, inside the building of the hospital, taking care of very sick patients and dying patients, I have a lot of experience in that. So I'm going to share with you to just help help the community, and especially focus on the NRI Indians, or our Indians coming here and living here for a long time. So please subscribe. I will see you later. Bye bye.